Hi, welcome to Ask Dr. Tan. So this is a series that every week we take questions from you guys on the internet and then we consolidate them and try to answer them as best as we can. Okay, so this week our topic is actually on STDs and not the health of the patient, but actually the health of the partner. Right? So the most common question we got is, do I need to tell my partner if I have been diagnosed with an STD? Okay, now if you look at the legal requirement in Singapore under the Infectious Diseases Act, a person who has HIV or suspect that he or she might have HIV is actually legally required to inform his or her partner prior to having sexual intercourse. For the other STDs, there's actually no such legal requirement. That said, it would be a good idea, and I think it's probably the nice thing to do, to let your partner know if you have been diagnosed with an STD, because you really want him or her to go get tested and treated before it actually causes more complications, right? So it might be a comfortable conversation to have, but honestly, from a medical standpoint, it is a good idea. So the second question is, can my partner undergo treatment without getting tested first? This is very interesting. This actually is called rapid initiation of therapy for the partner and is recommended by the US CDC. So when we do diagnose patients with common STIs like gonorrhea or chlamydia, it is recommended by the US CDC to get the partner on treatment even without testing, right, so that you can break the cycle of infection. Right? That said, obviously make sure that you have this conversation with your partner and make sure that he or she does not have any kind of drug allergies or any other kind of medical problems first before actually giving your partner the medication. If you're not sure, it's always best to see a doctor or get your partner to see his or her doctor. And the last question is, well, I've just been cured of an STD by my doctor. When can I start to have sex with my partner again? Okay, this is a very good question. So for most common STIs, especially things like chlamydia, we will actually recommend what's known as a test of cure. So you'll notice your doctor will tell you, hey, take these medicines and then see me again in 2 or 3 weeks to test again to make sure it is gone. It is best to confirm with a test of cure that you're actually free of the infection before you start any kind of sexual interactions with your partner or with anyone else. Because honestly, you really don't want to have that, that first initial uncomfortable conversation you had with anyone else by telling him or her that he or she could be at risk of an STI, right? So the answer to the question is, please do a test of cure before you become sexually active again. Alright, that wraps it up for this week. I'll see you guys again next week.